Good evening, everyone. Hello, it's 7:05 p.m. here in Ontario, and we are about to start to kick off our webinar on care for orphan puppies and kittens. So first of all, thank you very much for joining us tonight and listening to me in Franglish, as usual, discussing this very interesting topic, which is how to deal with orphan puppies and kittens. And again, the goal of tonight is really to share with you the essential things shelter staff and volunteers need to know when it comes to these very specific beings, because puppies and kittens are indeed very, very specific. And I think, as you know, when you work in an animal shelter, when you deal with dogs and cats on a daily basis, etc., you know that especially the shelter environment is a challenging environment. You face challenges related to infectious diseases on a daily basis. You have the challenges of adoptions. You have the challenges of overpopulation of animals inside your shelter. So definitely it's not an easy environment, and that's something I wanted to acknowledge before we start, because we need passionate people like you guys to work in shelters, and I'm very happy to be able to have this discussion with you tonight regarding how to deal with newborn puppies and kittens, because this is part of one of the many challenges you guys have to face on a daily basis. And it's always good to have some information on what you guys can do in the shelter to promote the health and really help those newborn puppies and kittens. Because on a daily, well, not on a daily basis, but one of the most common situations I hear in shelters is that sometimes, you hear somebody knocking at the door, and you go to open the door, and when you open the door, this is what you will find: a basket full of puppies or kittens, newborn kittens or puppies eventually. When we speak about newborn kittens and puppies, we really focus on the period that goes from birth to approximately 3 weeks of age, which is this time where they are really dependent on their mother. But unfortunately, when they arrive at your shelter, very often there's no mother. So you will have to take the place of the mother and to replace her, and in order to help those newborn puppies and kittens. So, and to tell you the truth, it's not something always easy for a simple reason. When it comes to puppies, kittens, especially newborns, during this very specific period that goes from birth to 3 weeks of age, it's not uncommon. It raises lots of questions. And I spoke with many volunteers and many shelter staff in different places in Canada and in other countries. And very often people wonder, okay, we just got these newborns, but what do we do with them? What should we look for? What are the most, do they work like smaller versions of adult cats or dogs? Be aware that this is a question that comes up very often, and not only in the shelter world. In fact, very often, even in veterinary medicine, this is a very obscure, a gray area of veterinary medicine, because there's not so much about it. And when we are vet students, we don't learn a lot about how to deal with newborn puppies and kittens. So the goal of tonight is really to give you some indications, give you some tips that you guys can use inside the shelter to support and to help those newborn puppies and kittens. And in order to start, I just wanted to tell you a little story. When I started veterinary medicine, it was a long time ago now. I first started I was practicing in an emergency clinic in Paris. And so this is the picture of the clinic. So if you ever go to Vincennes, which is in the suburbs of Paris, a very nice city, very nice place with a nice castle, and maybe you will run into this veterinary clinic on the Boulevard de Vincennes. And I was working there during 3 years, and I was doing emergency consultations. So when I left the vet school, I was ready to deal with gastric torsions, acute edema of the lungs, poisoning in dogs and cats, etc. These are the most common emergencies we are used to deal with in veterinary medicine. But one night, it was a Christmas Eve, by the way, somebody brought me a newborn puppy. a very young puppy they just found. The puppy must have been 3 days old. And they brought this puppy and they were asking me, okay, we just found this puppy, but we are not really sure what to do with it. It's an orphan puppy. There was no mother. It was abandoned. How do we know that this puppy is doing well? What should we look for? What should we do? And I must admit at this time, again, I had left veterinary school a few months before. I just scratched my head and thought, okay, what should I do? Because I knew how to approach an adult. I was trained to approach adult dogs and cats, but I wasn't trained to deal with newborn puppies and kittens. I mean, I had half an hour concerning canine and feline neonatology at the vet school, so I wasn't really prepared. And as I said, I just scratched my head, and at this time, I approached it as I would have approached an adult individual. While it was definitely not the case. Later on, when I started specializing myself in canine and feline reproduction, I spent much more time learning about newborn puppies and kittens. And this is when I realized that puppies and kittens, newborn puppies and kittens, are totally different from adults. They are not smaller versions of adults, and even the normal health parameters we check in adults are different in newborn puppies and kittens. And these are things that are really essential for people who work in shelter. If you ever have to deal with newborn puppies and kittens, these are essential things you guys need to know in order to help those newborns. So in order to evaluate neonates at intake when they arrive at the shelter, in fact, as I said, it's totally different from an adult. So you cannot just say, okay, we will look for the same health parameters, the same body temperature, the same heart rate, the same respiratory rate. It's totally different. And in fact, maybe you know this woman. I often like to show this picture, and I get a ton of different answers. I got Marie Curie, I got Margaret Thatcher, etc. But she's not any of these. This lady is very famous in human neonatology. And this lady, I'm sure the name will sound familiar for many of you. It's called Virginia Apgar. So Virginia Apgar is a well-known human pediatrician who was working a lot on how to, who in fact developed a scoring system on how to evaluate newborn humans and the health, in fact, of newborn humans. And this is what we call the Apgar scores. And the Apgar scores, in fact, they use a name to create an acronym that shows the main parameters we will focus on when it comes to a newborn in order to evaluate its health. Apgar stands for appearance, pulse, grimate, activity, and respiration. These are 5 parameters that are used in human medicine to evaluate the vitality and the health of newborns. And we can use these same parameters in veterinary medicine too. There was a paper published in 2009 that in fact focused on how to adapt those Apgar scores to veterinary medicine. And typically when you receive a newborn kitten, and if you're not really sure if a newborn kitten or newborn puppy, if you're not really sure how good they are or if they're in good health, etc., you could eventually use those Apgar scores. This is something we use more and more today in veterinary clinics, especially when we do a C-section, etc., to evaluate the vitality of this newborn. And as you know, the Apgar scores, basically we focus on a sign, and we will give a score depending on what is observed. And then when we will make an addition of all these, scores, we will have in fact we will have the Apgar score that will tell us, will give us an idea if the puppy or kitten is doing well or not. So the first thing we will focus on is the color of the mucosas, the color of the gums, the color of the ocular mucosa you have in newborn puppies and kittens. If it's cyanotic, which means typically blue, that we don't have any, where there's a lack of oxygen, etc., then we'll score it 0. If it's pale, 1. If it's pink, that's what we look for. A healthy mucosa should be pink. The score will be 2. We will evaluate the presence of reflex if the animal has no reflex at all, or if it is vigorous. The heart rate is also something that will be evaluated. And you can see here one big difference between adults and newborns, because in adults, in newborns, the heart rate should be above 220 beats per minute, while in adults, it will be much less than that. We'll also focus on the respiratory effort. And this is something extremely interesting. There's a phenomenon we call a metabolic acidosis that many newborn puppies and kittens can suffer from. Usually it happens when it took a long time for them to be exposed from the womb of their mother. And when it's always important to check all their breath, because if you are under the impression that the puppy has to swallow air, or if the respiration is abnormal, or if there are not enough respiratory movement, this definitely sign that there's an issue and will require veterinary assistance. But as you can see, this is also something that can be evaluated with the Apgar scores. And we'll also look at the activity of the animal, if they're flaccid and not moving, or if they are in active motion. And this is definitely something you can see when you look at the big picture of these Apgar scores, etc. Depending on the score you obtain, any score below 6, below 7 will require medical support. And at this stage, if you ever have any issue, if you see that the score is below 7, this you will need to go to your veterinarian. But above 7, usually puppies are fine. And this gives you a very easy way and to evaluate quantitatively the health of the newborn puppies in case you're not sure, because it's not always easy when you deal with newborn puppies and kittens, and very often, if you're not used to them, you might wonder if everything is okay or not. And this gives you a very easy way to check at intake if everything is good or not. But that's at intake. Then when the puppies and kittens are inside the shelter, it's important to monitor them. And in order to monitor them, when you are a staff member, when you're a volunteer, there's only 2 things you guys really need: a thermometer and a scale. So we'll come back to that later. But if there's anything I think you guys need to have inside your shelter to monitor newborn puppies and kittens, if you don't have a vet on staff, if you have a vet on staff, a veterinarian on staff, that's fantastic. It really helps you guys when it comes to dealing with newborn puppies and kittens. But if this is not the case, there's only 2 things you really need: a thermometer and a scale. These are the essential things that will help you monitor the health of these newborn puppies and kittens. And let's see why. Because when it comes to newborn puppies and kittens, recently I was reading a book. It's called Small Animal Pediatrics. And inside this book, it was written that certainly one of the most common causes of neonatal mortality in newborn puppies and kittens, again from birth to 3 weeks of age, must be poor husbandry condition and poor nutrition. And that must be certainly one of the most important cases when you deal with orphaned puppies and kittens, because again they don't have a mother, etc. So husbandry and nutrition will be essential things to focus on to promote their health, etc. And there's something in veterinary medicine we call the 3H syndrome. So I'm not sure if it's in veterinary medicine or it's just me, but this is something you will hear a lot if you come to attend to our talks, because the 3H syndrome, 3H stands in fact for hypothermia, hypoglycemia, and dehydration. These 3 diseases somehow are certainly one of the most common causes of neonatal mortality in newborn puppies and kittens, but certainly in all other mammalian species. And the good news is that these 3 things are something that can be easily monitored by you guys, even if you don't have access to a veterinarian in your staff, and that can easily be prevented. So it's just important to know about them in order to be able to prevent them. And that now we're going to cover a little bit what you guys need to know on that. Concerning hypothermia first, concerning temperature, something people usually don't know is that puppies and kittens, they are not able to regulate their internal temperature during the first 3 weeks of their life. So when they are born, basically, during those first 3 weeks, if they get cold, they will not be able to shiver like adults will do in order to increase their body temperature. So if they're cold, they will get colder and colder. That's why they need their mom, because the mom typically is a source for food, but also a source for heat. And that can really be a problem. One interesting thing about newborn puppies and kittens too, I like to ask people in the room when we do this talk, what is the normal body temperature of a puppy or kitten? And very often I will get answers like, oh, it must be 37, 38, 39, which is what we're looking for when we deal with adult cats or dogs. But in puppies and kittens, the first week of life, the body temperature will be around 35 to 36 degrees. So as you can see, if you were referring to values for adults, you will consider that they are in hypothermia, while in fact 35, 36 is totally normal for a newborn kitten, newborn puppy and kitten. And they will stay at this temperature for the first 2 weeks of age, and usually they will reach temperatures that are similar to adults around 3 weeks and a half. But there's something important about this body temperature. When they are hypothermic, if the temperature drops below 35, they become less active. And, since they become less active when they are with the mother, for sure they don't have access anymore to the mammary gland and are not able to drink anymore. And in the case of orphan puppies like yours, it's even way worse, because when the temperature drops below 34, those puppies, those kittens are not able to digest anymore. So typically, very often when we deal with a newborn which is not doing well, the first reflex that people will have is to try to bottle feed them or even tube feed them in order to give them nutrition in order to help them face this difficult situation. While in fact, the first thing you need to do is always to check their temperature, because if you start to feed them while they are below 34 degrees, they are not able to digest. So the milk you gave them will accumulate in the digestive tract, typically in the stomach, that will bloat, and that can in fact lead to problems and can eventually lead to the death of the newborn puppy and kitten. So always important first to remember that below 34 degrees Celsius in body temperature, there is no more digestion. And if the temperature drops below 32 degrees Celsius, then the puppy and kitten will lose their suckling reflex. And if they are not able to suckle anymore, for sure, and this is something that is easy to check, you just put your finger in the mouth of the puppy and kitten, they typically should suckle it. It's really a reflex. If they don't do that, it's probably because the temperature is below 32 and they are too weak to suckle that. And then, obviously, if you don't do anything, if you don't warm them up, then they will not be able to get the proper nutrition, and we'll see that it's kind of a vicious circle. So that's why anytime you deal with a puppy, a kitten, which is not doing well during the first 3 weeks of age of their life, check their body temperature. You can use a rectal thermometer. It's well tolerated by the newborn, and that is clearly something essential because, again, below 34, no more digestion. Below 32, no more suckling reflex. And the second thing, if you determine that these newborns suffer from hypothermia, etc., you need to warm them up. So you have different techniques to warm them up for sure. The most common one that is used is the heat lamp. Some people use also heating plates, and these I really like the heat lamps because they create a cone of warmer temperature that gives the opportunity to puppies and kittens to move away from it if they feel like it's too warm. Basically, under the lamp, we recommend that the temperature should be 30 degrees Celsius the first week of life, 28 degrees Celsius the second week of life, and 25 degrees Celsius the third week of life. So again, I know that some people tell me sometimes, oh, it's too much, etc. But these are recommendations, and these are usually when we get the best results in terms of maintaining the optimal body temperature for these newborn individuals. The best option would be to have a human incubator like this one. And when I show these pictures, people often tell me, oh, no, that's not possible to get one in a shelter, etc. Well, in fact, I've seen many shelters across Canada who have access to these kind of incubators. If you have a good connection with a human hospital, etc., it's not impossible that you can get a hand on one of these old incubators for humans, which are very nice because it will help you warm up the puppies and kittens, and at the same time you will be able to control the humidity inside their direct environment. But very often you don't necessarily need a human incubator. You can as well use an incubator for poultry or an incubator for parrots or reptiles that are sold in some pet stores. So there are alternatives out there that can help you warm up a newborn puppy and kitten. One thing that is essential also when you warm up a newborn puppy and kitten is this must be progressive. So I always say as a joke, don't try to microwave them. That's really not a good option. This must be a progressive warming up over 1.5 hours to 2 hours, because if you warm them up too fast, we will have modification in their blood that can lead to side effects and eventually the death of the newborn. So it's important for this warming up phase to be progressive over 1.5 to 2 hours. And this is usually something easy to recreate with the temperatures I gave you or with the use of an incubator, whether it's a human one or a parrot, poultry, whatever one. So obviously, if the newborn puppies and kittens are cold and they don't eat and they are not able to digest anymore, what can develop then is something we call hypoglycemia, because they are not able to receive this nutrition that is required to sustain, in fact, the functioning of the different organs of the body. And that's why puppies and kittens, what makes them even more predisposed to develop hypoglycemia is that puppies and kittens have few glucose reserves at birth. They are very different from adult cats and dogs who have reserves that they can use in case they're starving, etc. In newborn puppies and kittens, if they don't receive proper nutrition, during a certain 4, 5, 6 hours, they are really predisposed to develop this hypoglycemia. And some smaller breeds, if you deal with Yorkie-like dogs, etc., it's really not uncommon that the smaller dogs will develop hypoglycemia very fast. From a clinical standpoint, you will have puppies that are presenting seizures, which are really weak and are absolutely not moving, etc. So these are the typical clinical signs of hypoglycemia that are observed in newborn puppies and kittens. Again, because they have few reserves at birth. Usually, the reserves they have at birth depends on how the mother was fed during pregnancy. But for sure, when you deal with orphaned puppies and kittens, it's really not uncommon that the mother was not properly fed. And that explains why hypoglycemia is something you guys might see more often than in any other kind of situations. Moreover, what makes them also predisposed to that is that the main organs that are supposed to support the digestive function and to mobilize energy in case it's lacking, the liver, the pancreas, are not functional yet, because these are newborn puppies that are still immature. And since these organs don't work properly yet, if there is a state where they are lacking glucose because they were not able to be fed, they were not fed properly, etc., the liver and pancreas will not be able to mobilize this glucose, etc., and they have more chances again to develop hypoglycemia. The regulation is essentially through feeding, and you know that when you have the mother around, basically the newborns will have something between 12 to 20 meals per day during the first 3 weeks of life. So they eat as much as they want, well, not as much as they want, but as often as they want. If you don't have the mother around, if you deal with orphan puppies and kittens, you guys will have to take care of that. And that's certainly the most consuming part, the most time-consuming part of the process. The first week, we usually recommend to feed them 8 times a day. every 3 hours. Imagine what it represents if you have to deal with a litter of 12 large-sized dogs. Second week, at least 6 meals per day. Third week, at least 4 meals per day, sorry. And after the third week, typically, what is recommended is to wean them and to pass them onto solid food, because this will be much easier to deal with them. But during the first 3 weeks, it will be a lot of work. And I know that very often newborn puppies and kittens don't stay in shelters because of the risk of infectious diseases, etc., which is totally normal. So they stay at foster homes with some volunteers and some shelter staff, etc. So keep in mind, it will be a lot of work, because when during the first week you have to bottle feed them every 3 hours, it's clearly a lot of work, and if you don't do that, then they could eventually suffer from hypoglycemia. While we're on the topic of feeding, keep also in mind that newborn puppies and kittens are not able to defecate and urinate by themselves. So each time you feed them, you need to the defecation and urination, and miction is a reflex that is usually stimulated by the mother licking the perineal area. So in case you don't, in case you don't have, you have to bottle feed them, you will have to stimulate this perineal area, typically with a humidified tissue, etc. After each meal, in order to stimulate defecation and urination. If you don't do that, they will not defecate, and they can somehow become contaminated by their own feces because they are not able to evacuate them. Because they don't drink milk, and because they are not, if they are hypothermic and hypoglycemic, etc., because they don't have access to proper nutrition, they become weaker, and again, because milk is 19% water, they will develop dehydration. And that's why that's the third H of the 3H syndrome. Puppies and kittens basically are more than 82% water, much more higher concentration in water compared to adults, which means that any kind of dehydration will have much more severe effects than in adults. Very often as well, I see people want to evaluate the hydration status of a newborn puppy, newborn kitten, and they do like we do in adults. They do a skin, they check the skin fold. Keep in mind that this doesn't work in newborn puppies and kittens. You have different ways to do this. Very often in veterinary medicine, we will assess the density of the urine of these newborn puppies and kittens, and we know that above a certain value, they are dehydrated. That's a very, very efficient way to check the hydration status. The most easiest way for you guys is to check how humid the gums are. If the gums are humid and you can feel they are humid when touching them, typically the hydration status of the newborn is okay. If you feel they are very dry, this shows you that they are dehydrated, and this should push you to find a way to give them liquid, basically through milk and through bottle feeding, to correct this hydration status. But remember that just checking checking the skin fold will not be sufficient to evaluate the hydration status of the newborns. More than that, the skin barrier is not completely effective yet in newborn puppies and kittens. The kidneys are immature, so if they are dehydrated, there's no protective mechanism to protect the liquid that is still inside the puppies and kittens. So if they get dehydrated, they might get even more dehydrated because they don't receive any water from outside, because the mechanisms to protect them, to protect the adults, are not efficient in newborn puppies and kittens. So in veterinary medicine, when we deal with a newborn puppy, kitten, which is dehydrated, basically what we will do is that we'll try to put an IV route or to put a catheter we will do a fluidotherapy. We'll put them under fluids like we do in adults. Not always easy. Having an IV route in newborn puppies and kittens is definitely something hard because the veins are very small. But the easiest way to do it is to use what we call an osseous root. So basically, we put the catheter inside a bone. Very often, the femur or on the hind leg, which are the best routes that we can access in newborn puppies and kittens. And I remember a few years ago I had in consultation a newborn kitten which was suffering from hypoglycemia, and it's amazing how fast they recover when you start to administrate fluids through intraosseous routes. So, but this is a very technical procedure. Well, it's not very technical, but you need to, usually it's something performed by a veterinarian, and I totally understand because it's something staff and volunteers are not used to do, and it can be a little bit scary if you're not used to put those intraosseous catheters. But the other way that you can deal with the dehydration is definitely to bottle feed them. As I said, first week 8 meals per day, second week 6 meals per day, third week 4 meals per day are recommended. Very often we will recommend 1 to 5 milliliters of milk for 100 grams of puppy and kitten, but today we have feeding guidelines that are adapted to the size and to the nutritional requirements of these newborn puppies and kittens that are essential. Because orphan puppies and kittens, when you put them under, when you start to bottle feed them, they have a tendency to become greedy, and especially if you have puppies that look like Labradors, etc., they might be able to drink the entire bottle. If they drink too much, their digestive capacities will be overloaded, and if this happens, they will develop diarrhea, which again can lead very quickly to a severe dehydration. So in case you ever have to deal with newborn neonatal diarrhea or even neonatal constipation in newborn puppies and kittens, be aware that if you play with the concentration of the milk replacer you use, that could help not fixing the most severe cases, but at least if it's only related to the amount of milk they absorbed, by playing with the concentration, it could be a way to fix it. When you deal with constipation, for instance, we will decrease the amount of water inside the milk, which is kind of counterintuitive because typically when we deal with constipation, we want to increase the amount of water. Today, we recommend to add 80% of the recommended volume of water in, when you dilute the milk in order to fight constipation. Because when the content will arrive in the gut, it will create what we call a call for water that will help deal with the constipation. On the other side, if you deal with diarrhea, we will over-dilute the milk by using 120% of water or of the recommended volume of water. Again, in order to give them the fluids they require, but not feeding the things that are creating the diarrhea, most of the time the bacteria that are in the gut. So as you can see, there are ways you can try to help these puppies in case you ever run into neonatal diarrhea or neonatal constipation, just like playing on the concentration of the water of the milk you give them. Something else you need to focus on when it comes to hydration of the puppies is, which is very important, is the humidity you have inside the building. And this humidity must be around 65% humidity. Very often in shelters, well, it depends on the structures, but very often we usually deal with environments that have a higher level of humidity. It's less common to be in environments with your humidity level below 65. It can happen. I visited some shelters where they were around 50% humidity, but especially around the Great Lakes, it's not uncommon that you are above 65. And if you can control this humidity level, this is also a very good way to prevent dehydration. And we'll see that when it comes to infectious diseases, this is also a critical parameter. Coming back to canine and feline milk replacers, this is a story I shared on our blog, and it's maybe you heard about that a few months ago. There was a publication on social media, and it made a big buzz. It was a woman in Colorado that got an orphan puppy, and she didn't know what to do because there was nobody around, and the puppy was crying, and she decided to breastfeed this newborn puppy. As I said, it made a big buzz on internet. She went on the news speaking about her story, etc. The good news is that everything ended up well. The puppy was fine, and he's doing okay. But when I heard that, the first thing I thought, because there were interviews of veterinarians saying that this shouldn't be a good thing to do, because obviously if this woman was breastfeeding the puppies, certainly she was also breastfeeding a kid, and there were risks for some diseases to be transmitted from the puppies to the humans, etc. The first thing I thought was that, well, we're lucky that this puppy didn't end up with a diarrhea, because what can happen in this case, the milk of the bitch and the milk of the carnivores in general is very, very specific. Keep in mind that the growth of puppies and kittens is really fast compared to humans. And the milk of the bitch, the milk of the queen, are very specific composition, are highly energetic, and the risk when you use a milk that is different from the one that the species usually receives is that the guts of these newborns are not able to digest it, are not able to process it, and it will turn into diarrhea and then lead to dehydration and the 3H syndrome, as we mentioned before. So that was a big risk here. Fortunately, it didn't happen, but keep in mind that this is always a risk. And that's the same thing. There's a very old myth that is around in canine and feline medicine that goat milk is a good alternative to canine and feline milk. And unfortunately, that might have been true 15 years ago. That might have been a nice alternative, but we know that today, again, canine and feline milks are very specific. And if you look at their composition, like on this table here, CP stands for K prime, so goat, CN for canine, and CT for cat. So look at the energy level between the goat milk and the canine and feline milk. So there are huge differences. The canine and feline milk are way more energetic, and that's certainly again because of the growth curve, which is faster in newborn puppies and kittens. And if you feed them with something different, sometimes everything can go well, and that's good. But I hear many stories when these puppies and kittens were fed with a human milk replacer or with goat milk, and they develop diarrhea. And again, this can be a very critical state issue for these newborns because they can quickly get dehydrated. One thing important as well, since I'm speaking about the human milk replacer, puppies and kittens at birth don't have the capability to digest starch. And very often in human milk replacers, you will find starch. So if you give them a human milk replacer at birth, there's also a risk they will develop diarrhea because they are not able to digest what is inside. Because again, they don't have the ability to digest starch, which is something very specific to canine and feline. So that's why they definitely require specific nutritional solutions. And the good news is that today we have on the market dedicated canine and feline milk replacers that I definitely would recommend you to have on hand, because in shelters you'll never know when puppies or kittens will come to your door. I think it's especially important during kitten season. I know that some shelters report that they don't see any more kitten season and they receive kittens all year long. But if in your specific area you still see a kitten season, when you know this is approaching, it's good to have a milk replacer on hand because you'll never know when these puppies, kittens will show up. And when you need it, when you need this product, you need it right now. So it's good to have it on hand just to be prepared again. So as I said, the problem with the 3H syndrome is that it's a vicious circle. Very often it starts with hypothermia, and the puppy, kitten are not able to digest anymore because they're hypothermic, because their temperature is below a certain level. And since they are not able to digest and to heat, they become hypoglycemic, and this reinforces the issue that will lead to dehydration. So it's really a vicious circle because if it starts with hypoglycemia, it can go the other way around. So the three of these symptoms are linked together. The three of these issues are linked together, and the good news is that they are not very difficult to control in a shelter environment, because these are husbandry parameters you guys can check, and these are clearly the most essential things you need to check in newborn puppies and kittens. And there's one important rule that I told you there are only two things that are mandatory when you deal with newborn puppies and kittens, a thermometer and a scale. Remember that a healthy puppy, a healthy kitten gains weight on a daily basis. So when you monitor them, weigh them on a daily basis. Because typically, well, if they're healthy, they will gain weight every day. We don't have, well, in certain textbooks, you'll see that puppies and kittens are supposed to gain 2 to 4 grams per kilogram of adult body weight per day. To tell the truth, the only rule that matters is that they must gain weight on a daily basis. And they can usually lose weight the first day after birth. They can lose up to 10% of their initial birth weight, because they will defecate what we call the meconium, the first feces, that is usually harder and can represent a large amount of their initial weight. But after that, on the second day, they should start to gain weight. And when you observe weight loss, this is usually the first clinical sign you will see before when something goes wrong. So a puppy or kitten which is not doing well will start to make a plateau in his growth curve, or will start to lose weight. And when you see that, typically, this is when you observe that, this is when you should start to have a deeper look on this individual, and maybe check the amount of food you're giving it. Maybe it's not getting it properly. Maybe you need to increase the amount of milk you're giving them. And if, despite all your efforts on the feeding part, they're still losing weight, it is not fixed after 24 hours, it's important to ask for veterinary consultation. Again, this is the first clinical sign that will be observed before anything else. If you see a stagnation in the growth or a weight loss in newborn puppies and kittens, if you are not able to fix it in a 24-hour period, this will require a veterinary consultation. And that's something very easy any shelters can do. The 3H syndrome is certainly one of the most common causes of neonatal mortality when you deal with orphan puppies and kittens. But there's also always a risk for infectious diseases, because these newborn puppies, these newborn kittens, they are really immature, they have no immune system, they don't have a strong immune system, and they can be susceptible to many pathogens that are in shelters. And that's why most of the time you don't let them in shelters. You will put them in foster homes where the infectious disease risk is really lower than what you observe in shelters. And as I said, at birth, they don't have immunity usually. They have no immunity, and their immune system of the puppies and kittens is in fact obtained through what we call the colostrum consumption. The colostrum is in fact the first milk secretion of the mother, of the bitch, or of the queen, that contains a lot of antibodies, which are proteins that are in fact here to protect the individual against infectious diseases. And this colostrum is enriched in specific antibodies that the mother had in her blood, and typically antibodies against diseases the mother was vaccinated for, or diseases the mother encountered during her life. But the problem is that when you receive newborn kittens, when it comes to colostrum, we don't know how long. It is usually mainly secreted during the first 24 hours after beginning of lactation in the mother. So very often, if you receive orphan kittens and orphan puppies, maybe they didn't have access to the colostrum. And the newborn puppies and kittens must absorb this colostrum in the first 24 hours after their birth to be able to absorb the antibodies and to develop this immune system. So very often in your case, maybe they didn't receive this at all. And this is a study that was done in 2012 that was very interesting because they compared the rate of absorption of antibodies after birth in newborn puppies, and they realized that it just shows you what I just told you. The antibodies are absorbed during the first 24 hours of birth, and in fact, they are absorbed. In the peak of absorption is usually at 4 hours after birth. So they need to absorb it as quickly as possible. And the problem is that very often the orphan puppies and kittens you receive might not have absorbed that. We have ways to check in veterinary medicine if they got the colostrum or not. We can do a blood sample and we will check for very specific parameters that will show us that they indeed consume the colostrum. But in your case, it's always important to assume that they didn't receive anything. And very often people will say, okay, they didn't receive the colostrum, which means they must be really weak and they are very fragile, and any disease that is around can be an issue. The good news is that there are alternatives today for these individuals that didn't receive the colostrum. Colostrum contains antibodies, and antibodies are contained in the blood of the individuals, in the blood of the adults, and basically in a part we call the serum. So one alternative that was recommended in the past was, especially in shelters, to eventually collect blood on healthy individuals, obviously individuals that do not suffer or didn't suffer from any infectious diseases recently, and to administer this serum eventually orally or subcutaneously to these newborns in order for them to build this immunity they didn't receive at birth. And this study from 2001 that was done in kittens in the US shows you that, in fact, if you look at the dark blue line, these are kittens that didn't receive colostrum compared to the pink line where kittens receive colostrum. If you give them, the two other lines are kittens that receive serum subcutaneously or intraperitoneally. We can see that when we administer serum after birth, right after birth, it can increase the amount of antibodies in their blood, and it's very similar to what we will observe compared to kittens that would have drink the colostrum. The issue is that it's not really practical because we will usually need 5 milliliters of serum per kitten, and to obtain 5 milliliters of serum, very often you'll need 10 milliliters of blood. Not always easy to collect, especially when you have a large litter to deal with. So it's an interesting alternative. It could work well if you have enough donors, and if you it could work well, and it could work well in kittens. In puppies, in fact, we know today that one of the main differences we have between newborn puppies and kittens is that the colostrum of the bitch it contains way more antibodies than the colostrum of the queen. So if this administration of serum works in newborn puppies and in newborn kittens, it doesn't work that well in newborn puppies. And there was a study that showed that when you administer serum to newborn puppies, you don't have an increase in the rate of antibodies in their blood despite this administration of serum. So today this is something recommended that can be tried in kittens, but not necessarily in puppies. And maybe you know that there are alternatives to colostrum, frozen colostrum, dehydrated colostrum for horses or for bovine, etc. Some studies have shown, like you can see here, that if you give those colostrum derivatives to newborn puppies and kittens, you will have an increase in antibodies in their blood, and that could have been an interesting alternative. The problem is that even if you increase the amount of antibodies in their blood, these antibodies are not able to do something we call opsonization, which is in fact a phenomenon where these antibodies will inactivate or destroy a pathogen. So you will virtually increase the number of antibodies in their blood, but this will not protect them against pathogens. And moreover, the parvovirus in dogs and cats has nothing to do with the parvovirus in bovine or equine. So And today, colostrum derivatives from other species are not a good alternative. They can protect local immunity eventually in the gut, but they will not provide systemic immunity. They will not boost the immune system of these newborn puppies and kittens, and it will not protect them. So they are not interesting alternatives for our newborn puppies and kittens. The best alternative we have today, in the future maybe we will have colostrum banks, and this is eventually something you guys could do if you ever run into a bitch. So just give birth, and you could, some structures collect the milk of these bitches during the first 24 hours and store it in the freezer. This can be stored up to 5 months, up to 6 months to 1 year, and use it in newborn puppies if they ever show up. But to tell the truth, this is very rarely used in shelters, and it's very impractical. And today we don't have colostrum bank like in mares, like we have in equine and in bovine. But the good alternative is still to use a milk replacer. One of the role of colostrum after birth is for sure to provide immunity, but it's also an energetic booster. So what you can eventually do, if you don't have access to colostrum, it's always good to feed them a good milk replacer. You'll know that for sure they didn't receive immunity. This means that their vaccination protocol might be modified by your veterinarian because they didn't receive colostrum. So we know they are eventually weaker and more susceptible to develop infectious diseases. So maybe they will start to vaccinate them sooner than normal individuals. But the most important thing, even if you don't have the immune part of the colostrum, you can give them the energy part through an appropriate milk replacer. And that's something essential, again, just right after birth in these newborns. The infectious disease risk is mainly important because newborn puppies and kittens can more easily develop what we call septicemia. So to make it very simple, septicemia is typically a bacterial overgrowth that will overload the immune system of the individual and cause their death. And in newborn puppies and kittens, these bacteria, very often they come from two origins. The mother, but in your case, in shelters, usually you don't have the mother, so it's not the most common origin, or the environment. And typically, when you deal with an environmental contamination of a newborn puppy and kitten, this is what you could observe. Umbilical cord infection, ocular infection. Remember that puppies and kittens will open their eyes typically 8 to 15 days after birth. It's usually kittens can open their eyes earlier. I recently had a case where a kitten opened his eyes three days after birth. This is not the rule, but kittens tend to open their eyes earlier than newborn puppies. But if you ever deal with ocular infection, if you are under the impression that the eyes are swollen while they are not open, it could be pus that is located just behind the eyelid. Or skin infection are also very common when we deal with environmental contamination, which means only one thing. When you deal with neonates, the hygiene of their environment is definitely something key. So I know that we have talks where we speak during 3 hours about sanitation in shelters, etc. But it's very important when you have newborn puppies and kittens to provide them with a very clean environment. And one of the key things is, for instance, change the sheets on a daily basis. If don't put them in a cardboard box that will retain the germs and can eventually lead to environmental contamination, they need to be placed in something that is cleaned and disinfected on a daily basis, just to avoid the development of these bacterial contamination, which are the most common cause of septicemia in newborn puppies and kittens. And that, again, is something key and something very simple you guys can do. Just by cleaning and disinfecting the nest on a daily basis, you will prevent the development of these conditions. And there's also one thing you can do to help is to take care of the umbilical cord, especially if you get newborn kittens that are just born. If they still have the umbilical cord, keep in mind that the umbilicus is nothing else than a blood vessel that communicates with the belly of the puppy. So if you need to do whatever you can to prevent germs to ascend this cord and to get inside the belly of the puppy. So typically you can put a suture 2-3 centimeters away from the belly, cut it with clean scissors, and the most important part is to disinfect its terminal end with an antiseptic solution. And typically the umbilical cord will fall down 3 days after birth. So just by doing that on a daily basis, 2-3 times a day, this is the best way to prevent the ascension of germs inside the belly of the puppy. In many species, including humans and large animals, umbilical infections are one of the most common causes of development of bacterial infection in newborn puppies, in newborns. So that's definitely something very easy you guys can do to prevent development of septicemia in these animals. And that's it. So one thing which is important when it comes to neonatology, newborn puppies and kittens, is really in animal shelters to be prepared. This is true for any of the challenges you guys have to deal with. I mean, whether it's infectious diseases, adoptions, overpopulation, always important to be prepared. And it's also true when it comes to canine and feline neonatology. Remember the 3H syndrome. Remember, hypoglycemia, hypothermia, dehydration are certainly one of the most common causes of death in newborn puppies. And these, again, are things very easy that you guys can prevent and just by focusing on the husbandry of these animals. Always be prepared. Always have something on hand to feed them. Always have a good milk replacer on hand that is as close as possible to the composition of the milk of the mother. And especially when you deal with kittens, if you know when kitten season occurs in your specific environment, it's definitely important to have this on hand when kitten season gets closer. Because if you don't have it, this is usually when you need it right now. So it's important to have it on hand when needed. And focus on sanitation. Sanitation of shelters is definitely something extremely important. And even more important when it comes to newborns, because that's the best way to prevent neonatal septicemia, which are most of the time caused by environmental contamination when you deal with when you deal with orphaned puppies and kittens. And again, all these three things are things you guys can deal with and you guys can handle clearly. So that's what I wanted to tell you tonight. So thank you very much for attending to this webinar. I hope you learned something. I hope you enjoyed it. Something I wanted to tell you as well, keep in mind that the shelter community is a very small community. As I always say, I have the opportunity to travel across the country and meet many of you during the talks we do at shelters. So don't hesitate to, and we often learn many things from you guys and that we share on social media, etc. So don't hesitate to follow us on social media to stay connected, to be part of the discussion, because I truly think that the more of us will be part of the discussion, the better it will be in order to help this community move forward. At the end of the seminar as well, when you leave the virtual room, you will have access to a satisfaction survey. Please take time to take the satisfaction survey. It's always important for us to know what you thought about this seminar, and it's a way for us to improve the content we will propose next year. This was the last seminar we will do this year, the last virtual seminar. So I hope you enjoyed it. And I hope to see you back in 2015 because we will do other talks like this next year. Thank you very much. I will stop the recording and go back to the virtual room in case you guys have questions, but I just wanted to thank you for attending tonight. It's always a pleasure to spend time even virtually with passionate people, and I hope this presentation that you will benefit from what I told you during this presentation. Thank you, and see you soon. Bye-bye.